Hi, I'm Dr. Armstrong with Houston Healthcare, and I'm here to answer some questions that are frequently asked about mammography. Screening mammograms will assist with early detection of breast cancer, and it has been shown that early detection saves lives. So mammograms will detect a cancer that a patient may not otherwise know that she has. Typically, if in the absence of a strong family history or other circumstance, women should begin annual screening mammograms at the age of 40, and they should continue for years to come. Some women would say it's more painful than others. It can be uncomfortable. A lot of it depends on your body type and tissue density. Women that are uncomfortable during mammograms, we recommend perhaps taking a Motrin or a Tylenol before coming in, but it shouldn't be necessarily painful. Mammograms show many things. They can show tissue density, which has to do with increased risk of breast cancer in some women. It can show calcifications, which in some cases can represent cancer. It can show masses, which are sometimes just cysts and sometimes not. And it can show areas of what we call distortion, which may be the only sign of a cancer. They are not better than mammograms. Mammograms remain the gold standard for early detection of breast cancer, and findings on mammography will supersede findings on either of the other two modalities. Ultrasounds are very helpful in clarifying what we see on the mammogram. For example, on a mammogram, we'll see what we think could be a mass. So we send the patient to ultrasound, and it will tell us if it is full of fluid, so just a benign cyst, or if it's a solid mass that may or may not need to be further addressed. MRIs are extremely sensitive, but also not specific. So they are very good for screening tools in patients that are very high risk or have had breast cancer previously, and they are excellent for pre-surgical mapping for patients that are newly diagnosed with breast cancer and are going on to have surgery or treatment or both. It just means that we can't clarify exactly what we're seeing on the screening mammogram. So it could be that we see a mass that wasn't there previously, like I had mentioned, and we have to determine if it's full of fluid, so a cyst, or if it's solid. It could be that we see some calcifications that were not there previously, so we need a different type of mammogram with what's called magnification views to allow us to look at those calcifications more clearly and make a determination if it's something that we need to move forward with or just watch, or we can actually dismiss. So it doesn't necessarily mean that you have something bad. It just means that whatever we see needs clarification. Absolutely. Statistically speaking, the majority of women that are diagnosed with breast cancer do not have a family history. 1 in 8 women have breast cancer. So you should not feel it's a false sense of security to say, I don't have a family history, so I don't need a screening mammogram. Breasts are made up of basically fibrous tissue, glandular tissue, and fat. So the density is based on the ratio of those findings. So the more glandular tissue you have, the more dense your tissue is, which means on the mammogram it appears white. So it can obscure seeing certain things. It can be harder to read those types of mammograms. So with the increase in tissue density can come an increased risk of breast cancer. The more glandular tissue you have, the more likely you can develop cancer. Also, small areas, small lesions can be obscured in patients with dense breasts. So 3D mammography is extremely important in patients that have dense breasts. Yes, is kind of the short answer. I mean, our 3D mammography here is excellent at detecting almost everything. There are screening breast ultrasounds that sometimes can offer additional information, and it has been shown to sometimes detect things that are not otherwise seen. Ultimately, the best screening tool for patients with dense breasts, besides the screening mammogram, which is still above everything else, would be an MRI. Well, if it's a first-degree relative that has had breast cancer in your family, a mother or a sister, for example, it should begin 10 years prior to their diagnosis or at the age of 40, whichever comes first. For example, if your mother had breast cancer and was diagnosed at the age of 45, your screening mammogram should begin at the age of 35. We do provide 3D mammograms, and every single one of our patients is done with 3D mammography if they're able to tolerate it. It will allow us to show small lesions that can be obscured by overlying breast tissue, because it takes images in slices, so it will break up the tissue visibility and allow us to better detect small areas of change instead of having to look through all of the breast tissue and determine if there's something in there. It also will help to localize findings. It can tell us if we're looking in one view, if it's on one side of the breast or the other side of the breast, so that we can localize it more readily and target it if we need to. We do offer genetic testing. We have a screening tool that we give to every one of our mammogram patients to fill out, and if they qualify based on certain criteria, we will allow them to speak to a genetic counselor if they choose, and from there they may also qualify for genetic testing. We actually recommend every single one of our newly diagnosed breast cancer patients have genetic testing, and also if our patients have had genetic testing in the past prior to 2015, we recommend an updated panel because we have learned a few things since 2015. Thank you all for spending time and listening to me discuss the importance of screening mammograms. Please come out and get your mammograms. Early detections definitely save lives.